Action! Carolina had a question about osteoporosis, and osteoporosis essentially, if you break down the root word osteoporosis, osteo is bone, porosis means porous or thin. So osteoporosis, not to be confused with osteoarthritis. Osteoarthritis is when you have arthritic breakdown and buildup of bone. Weird looking bone that shouldn't be there, that's just trying to take extra pressure. Osteoporosis usually happens when you're older, and it leads to fractures. We don't like fractures. Certainly they don't kill you, but they make life just terrible. If this is the first time you're finding me, please hit the subscribe button down below and then the alert button as I put out weekly videos, tutorials, and others that might help you or somebody else. And share this if you know anybody that's going through it. So osteoporosis, how do we come up with it? Well, we have to come up with a thinness or thickness to your bone by getting something called a DEXA scan. Usually the suggestion that doctors follow is by the U.S. Preventive Services Task Force, and they've suggested that a DEXA scan starting at age 65, if you're a woman, and every 2 years, because that's all Medicare will pay for, it will find osteoporosis or find osteopenia. So let's talk about osteopenia. Osteopenia is when you have thin bone, but it has not become osteoporotic yet. Osteoporosis is pathologic. Once you hit osteoporosis, as far as a finding on your test, then the chances for fracture, whether it's hip, back, or any other fracture, is high. And we want to avoid that. Just like prediabetes, prehypertension, heart disease. We want to avoid going into full diabetes, full hypertensive treatment, cardiac arrest because of narrowing of the arteries. I mean, if you're in the US and we get to that point, it's kind of cool. We have a lot of great science that will fix you immediately if you're that bad. But I mean, if we can change you before we get to that point, I mean, that may be important. So if we can get bone thicker before you get to that high risk of 65 years or above, then that would be the goal of your doctor, your trainer, your nutritionist, to devise a way to avoid the pathologies that are associated with osteoporosis. It used to be that once you have your first fracture, as you got older, you're in the hospital, and usually life went downhill because of the loss of independence, the pain medicine that you needed, the difficulty with mobilization. You can't get out of bed anymore. You can't poop on a toilet. Can't shower. And people went downhill. Nowadays, we have surgical techniques. This is a hip. This is a hip and a piece of steel. I don't remember the components of this, but this is what you have to put into the bone to give you a new hip. I mean, if you can, so this is fantastic, and the surgeries are really fast, and the surgeons are very good at what they do. You got to get cement into the bone to get this to stick. You should do okay, but obviously to get it in there, you got to cut off the old head, put this in the new bone, and then you put a little a joint that this attaches to, and then you're good as long as your muscles are okay, or until the next side, the other side fractures. That's if the bone will actually accept this. So when you have osteoporosis, that's also the problem. If you're really severe, now this is a backbone. This is kind of a worn down backbone, but osteoporosis is when this nice strong matrix of bone is very thin and can't tolerate even a sneeze. I had a sister a long time ago, a sister who shrunk down because of chronic steroid use for her asthma. Every winter in Chicago, most of us have a cough or sneeze or a cold that we get, but she would have asthma and have bronchitis from the asthma during the winter because she couldn't tolerate it, and she was immune suppressed. Well, she would always cough terribly every winter and break something every time she coughed. Imagine that, every winter in Chicago, you know cold is coming and you're going to break something. And if it's a rib, okay, you have to deal with the pain every time you cough. But if it's a backbone, you're in the hospital for a short amount of time because of pain medications. You can't move. Again, just like that scenario, you can't get out of bed, you can't poop, you got to get somebody to take care of you, you can't go to the kitchen to eat. It's just down, and that's what happened to her. She went downhill really quick. I don't mean quick. She went downhill really quick that 1 year, but in the 5 to 10 years that preceded her death, it was just not a great life. So we try, again, to avoid getting to that catastrophe. But how do we do that? By acting on lifestyle change now. So I talked to you about the diagnosis and the definition, and how we as doctors come up with screening But I mean, if you're drinking alcohol, if you're taking in excessive amounts of caffeine and tobacco, I shouldn't say excessive amounts of tobacco, any tobacco is bad. Unfortunately, yes, alcohol is good at 1 drink a day, but if you have osteoporosis, osteopenia, or reflux for that matter, cut the alcohol. I only mention coffee and caffeine because usually it leads to my patients getting on proton pump inhibitors or H2 blockers. Proton pump inhibitor would be omeprazole, Prilosec, Prevacid, Protonix, Nexium. H2 blockers would be Tagamet, Zantac, Pepcid. Those medicines decrease acid, they help heal the gut, but I feel that people are on them forever, especially the PPIs. And I've done the videos on PPIs. When you're on a PPI for a long amount of time, you are actually speeding up osteoporosis. You're taking care of your stomach, but you're speeding up osteoporosis. You can stop all that by changing your lifestyle. You won't need the medicines that give you osteoporosis. So let's just talk about the treatment plan now. So again, if you have a doc that's going to get a DEXA scan, you're 65 years or older, and if you're a woman, and or you shrunk 1.5 centimeters if you're a man or a woman, or you just have back pain or an occult fracture from some other reason, it's important to get that DEXA scan. Now, when you get the DEXA scan, you will be given a score, T-score and a Z-score. I'm not going to get into that, it takes too long, but if your T-score, Z-score, if your score is -1 to or above, then you're cool. You're not thin. If your score is -1 to -2.5, then you're thinning. Not osteoporosis yet, you're called osteopenia. That's the first step into osteoporosis. And that's when doctors kind of scramble. A lot of my friends will just put you on medicines immediately. I wouldn't do that. Lifestyle change first. If you're -2.5 or lower, then you're osteoporotic. You probably should be on something or do something. So the medicines have side effects. You can read on the controversies. You can watch the doctors talk, the alternative medicine doctors talk, and figure it out on your own or ask me. And then there's something called a Frax calculator, though. This Frax calculator was put together by someone in the Commonwealth, a doctor, and it's really nice because you don't just look at the x-ray, you also calculate for risk. And what it's good for is if you're in that -1 to -2.5 range, where we're not bad yet, but we're getting bad. If you're undecided, then you put your numbers, you put your hip score numbers into the Frax calculator, and you can find it online, and you see if you're really at risk. If your risk for fracture is high, then you probably should consider more aggressive treatment. But aggressive versus not aggressive, that's what we're going to talk about treatment plans. So, as I mentioned already, tobacco and alcohol, you really should stop. Even for the benefits of alcohol that, like found in the French paradox, I wouldn't do alcohol. So I would try to switch over. If you're a caffeine user or coffee user and you have reflux, probably should get off the coffee. One of my best things for getting off coffee is to have some other stimulant. If you don't like tea, then forget it. But green matcha tea has no caffeine, but it's a stimulant and it's awakening in the morning. So think about this. There's ways to use it. If you don't like green, you can always start with black tea first and work your way down. But bottom line is get off the medicines that cause the problems and then the reflux. You see my video on PPI use and or GERD. Other things to do, get off crappy food. This is my usual model of McDonald's steak, egg, and cheese bagel. Used to eat these things all the time when I worked for Central DuPage Hospital. And I used to have 10 packs of McDonald's sugar in the large coffee that went with the steak, egg, and cheese bagel. I used to have 2 to 3 cups of coffee to wake me up, and then I'd have 3 or 4 beers to sleep me at night. So that wasn't good. I wasn't healthy back then. But I've stopped all that. And anyway, so choosing the wrong kind of acidic type foods will actually cause a leaching out of the bone. Bone is not only supposed to support structure, it's also supposed to be this sink, this reserve of calcium, phosphate, magnesium that the body can pull from. Because you need those things not only for strong bones, you also need those little elements for production of enzymes, hormones, digestion. You need all those things. So if you need more, then the body knows to pull it out of the bone. If you need less, then the body puts it back into them. That's the push and pull of how bone works. So in people that are totally stressed out, my small business owners, so I always say, let's check your magnesium level. When you're totally stressed, magnesium gets pulled out of your bone because you need the magnesium for tolerating stress, making cortisol, and a whole bunch of things, getting ready for fight or flight. Now, that's why it's important to check those things on a regular basis. I don't think my colleagues check magnesium that often, but I think it's important. Phosphorus is also important to check. So there's a couple other tests, not only in addition to the x-ray tests, there's also a blood test that we have to get to make sure that you're balanced. Vitamin D, calcium. I don't usually push calcium too hard because there's been some studies that calcium, if pushed too hard, like 1,000 to 1,200 milligrams per day, can be associated with heart disease. Now, I think it's important to eat calcium, but a supplement. But if you can get it in your food source instead of doing that crap, if you do more dark green leafy vegetables, nuts, legumes, you'll get your calcium per day. I don't drink milk, but I can get it in my fruits and vegetables, in my nuts, my legumes. I'll easily make up calcium, 1,200 milligrams a day, 1,000 milligrams for guys, 1,200 milligrams for women. So I would always say, if you come to see me, give me a 2-week diet diary, I'll calculate a couple other things. Priority for me is to make sure you're not going to have a heart attack, make sure you're not going to be walking into a stroke, diabetes, but I think it's important to always think about the osteoporosis. Really, if you take care of the first three, I think you'll be beating the osteoporosis anyway. The treatments are all the same. Anti-inflammatory diet. So that's most important to change to. I'll probably do a video on anti-inflammatory diet one of these days, but if you check out Dr. Andrew Weil, he's the guy I like to follow and I've learned with as far as anti-inflammatory diet. He's got a lot of videos out there. So it's essentially staying away from preserved foods, staying away from foods that have additives in them, staying away from highly acidic foods, getting more alkaline, staying away from meat. You don't have to be a vegetarian like me, but if you just decrease your meat, lower your cholesterol, that would be the objective. I sometimes will challenge my daily meat eaters to a meatless Monday and a fish Friday. At least that's 2 days a week that you avoid or you pretend that you're a vegetarian. Had a lady, and not to go off track, that was doing, her numbers for cholesterol, total cholesterol were 293. We just did omega-3 fish oil, which is also a good anti-inflammatory, red yeast rice, and she just added 2 days where she went vegetarian. She lowered her cholesterol 100 points. And that's better than any statin. That just goes to show you that you should be able to make a change with diet and exercise alone. So I've talked about the nutrition process and making sure you have your deficiencies taken care of as far as vitamin D. I've done videos on that. Now we'll talk about the activity process. I really think this is the way to beat it. A lot of my patients will say that they do 10,000 steps a day already. And that's cool. But if you did 10,000 steps a day and you're osteopenic or osteoporotic, then those 10,000 steps a day have to be added to. This is a weight vest, Gold's Gym weight vest. And I use it to give me some resistance. I usually don't, it's because it's so hot. I usually don't use this on a regular basis when I'm hiking. And hiking is another thing. I put it in here. This is a backpack, standard backpack. You can put this on your back. You don't have to buy this weight vest, it's 30 pounds. But if you just get a backpack and put some water, a gallon of water is equal to about 8 pounds. So 2 gallons, 16. If you just get a little bit more resistance and use water as your resistance, you can get a little bit of more work. If you impact, whether you're a walker, a hiker, or a runner, if you impact and you have osteopenia already, again, if you're already doing all this stuff and you have osteopenia, and then the repeat DEXA scan still shows you osteopenic, you gotta do more. So ultimately the doing more part or changing lifestyle will be up to you. If you're by yourself, I'd always suggest getting a coach. Whether I'm your coach, I'm actually the head coach, but if you can get a mindful practice coach like a psychologist, an exercise physiologist, personal trainer, or a physical therapist, physical coach, and then a nutritionist, registered dietitian, or somebody that's very good with their nutrition, I think those will be your coaches to help you make the lifestyle change. If you can't make the lifestyle change, if you can't afford the coaches, that's okay, but don't just not do anything. You might have to get on a medicine for osteoporosis because, again, just like my old nun lady, the patient that died, she died in 5 years, and every winter it was just an agonizing problem. So if we can get it before it gets to that point, then better off. So Caroline, a good question. Hopefully this all helps. If you know anybody, even if this doesn't fit you, know anybody in your family or in your friends that might benefit, please share this with them.